Hey guys, we're back at Coach's Corner here with Dr. Sean McBride talking about knee dysfunction. So specifically in the realm of meniscus tear, cysts, and early onset arthritis. So we addressed what happens or what your training protocol could look like if we have a meniscus tear, in your knee. Today we're back to talk about cysts and potentially arthritis and how we would manage that for an athlete.
Yeah, so basically, when we're talking about the meniscus, we're thinking of more like an acute onset injury. This is something that's more immediate and the immediate follow-on effects. Things like a cyst, certainly like an arthritis, these are very slow developing problems that are they're structural in nature, but they're glacial in their time frame, right? This is not something that happened all of a sudden. You can point to like the one movement where you're like, yep, it happened right then and there. It's kind of like, slowly over a few years, I started to notice something, and at some point it crosses a threshold where you're like, maybe I should check this out. And then you're like, your doctor's like, you got a little bit of arthritis in your knee. And it's like, well, what does that mean? What's a little bit of arthritis? It's like having like a little bit of pregnancy. Like you're like, I don't know, you either do or you don't have that. But that's kind of what we're thinking of is, it's still functional, but you're in this realm where now you're on this process where your knee is potentially going to become less functional over time. So now we're kind of figuring out, well, how do you maximize the function out of an imperfect joint?
Right. So when we're talking about like something like a cyst, kind of how does it get caused? Like, is it like a misalignment of the knee? Like, what are we taking a look at? Who knows, right?
Who knows?
Right.
This is one of those things, it could be that there was an injury at some point and that gets caused kind of as a follow-on effect from, an old injury. It could be that, something got into the knee or a piece of, say, cartilage or something broke off. There's such a thing as like a joint mouse. You'll hear that term every once in a while, but that's usually like a piece of bone or a piece of cartilage breaks off and your body kind of walls it off. So then you have this like free floating object inside your knee, which can become problematic. It's stuck in things. It's like literal, wrench in the gears. That's not the best for like overall knee function, but it's something that does happen from time to time. But the exact etiology, how these things start, no one really knows. But once you get it in there, it's like, okay, it's there. What are you going to do about it? If you're going to have surgery, you could take it out. Otherwise, you just have to maintain your best knee joint mechanics and figure out which movements are limited. And it can be very specific to the location. It could be different. If it's in the back of the knee, it might be deep bending that bothers it. If it's in the front of the knee, it might be straightening your knee out that bothers it. So it might be different based on where that is.
So going from a coach's perspective then, what do we do when it comes to a training protocol to be able to assist this athlete and be able to continue kind of their best format of training and exercise?
So as opposed to, say, the meniscus, where it's a stability problem and you need to train stability, this is actually a mobility issue. Arthritis is kind of the process of losing mobility in a joint. And as you get to the later stages, if you've seen any athletes or experienced this yourself, where you have a joint near the end stages of arthritis, it's extremely stiff, it's rough. You might even hear like grinding and creaking inside that joint. That's not the sign of like a healthy joint. But at its heart, it's a movement problem. It's actually an absence of movement. And so more movement is better in an arthritic joint. So getting the joint really hot, right? As opposed to like just hitting the ground running. This is the kind of person who might really benefit from wearing knee sleeves or doing like a hard 5 to 10 minute bike piece before they do any other kind of lower body movements. And actually you don't want to stop your heavy training. You can still lift heavy. You can even do things that are a little faster as long as you're really skillful with that. You can still Olympic lift, definitely deadlift, squat if it's not too painful. You might pick more back squat styles, more upright squatting where there's more forward demands on the knee might become less tolerable over time. But the best case scenario is moving a lot, moving often, and staying strong.
Right, so what I'm hearing is like, as opposed to with the meniscus tear, when we have something like arthritis or we have an extra kind of object kind of floating around our knee joint, we're just looking at using pain as an indicator of what ranges to avoid.
Yeah, potentially pain, or you might actually see stiffness, right? So in early onset arthritis or early stages of arthritis, depending on the athlete, you're probably not gonna see a really significant change in the joint range of motion, but you do wanna pay attention to that because that can be a sign that things are progressing. So you want to maintain full range of motion. You want to enforce that that athlete is straightening their knee all the way out, bending it as far as they can. Certainly, they're going to probably become sensitive to certain positions, certainly things that tend to put more strain or stress through the knee. So pistols might become challenging over time, and you might try to program different kinds of pistols, and then maybe we scale that back over time. But essentially you want to continue to do anything that is tolerated, i.e. does not painful or cause any sort of swelling or sustained pain later on. Because once you take something off the table, it's gonna be really hard to put it back on the table. So essentially you wanna keep doing the things you're doing. This is a definite use it or lose it situation.
I like it, use it or lose it. Well guys, that wraps up today with kind of knee dysfunction. Drop a comment or a question below. Your questions are our joy to answer. It gives us content to be able to continue to produce with you, and we'll see you guys next time.